Hi, everybody. This is Glenn Mays. I direct the Systems for Action Research Program for the Robert Wood Johnson Foundation, based here at the University of Colorado. And today I'm really excited to be talking with a recent grantee of the Systems for Action program, um, Kameron Hodges. We're doing some interviews with recent grantees, particularly those who have experience with community-led and community-engaged research studies, focusing in on testing system alignment strategies through S4A. Um, and Kameron, who's with me, be talking with us today, is definitely one of those community-based leaders and innovators. Cameron has served the Sarasota community in Florida as a longtime leader in the nonprofit sector. She's a former CEO and executive director of the Glasser Schoenbaum Human Services Center, which is a collaborative community of over 200 nonprofit organizations operating in Sarasota, Florida, with a shared mission of connecting and supporting human service nonprofits to better serve the community. And that Glasser Schoenbaum Center was really at the center of the research project that was conducted through the Systems for Action program. Kameron most recently served as the former director of community leadership at Gulf Coast Community Foundation, where she oversaw the foundation's grants budget and worked closely with nonprofit, civic, and government organizations in that community. She's got a PhD in developmental psychology and is still an active member on many different community boards and initiatives in Sarasota and that region of Florida. So, Kameron, thank you so much for joining us today.
Thank you, Glenn. Glad to be here.
Absolutely. So I wanted to start just if you could tell us a little bit more about the organization you led that was a part of this S4A study and the communities that it serves.
Yes. Well, as the CEO of a nonprofit, one of your main charges is to make sure the bank accounts are not only full, but have money coming into them to sustain your mission. So, as a director of a nonprofit campus, we supported 20 nonprofits on site, and then we're well connected with other ones off site throughout the really about 3 or 4 counties, contiguous counties. I struggled to define the importance of the work that we did. Why would a donor want to give us money for a new air conditioning, right? When we were 5 acres, 14 buildings, separate buildings. So this campus was built in the 80s. So there wasn't a concept of energy efficiency in building or, maybe we shouldn't have sidewalks all over the place when it's 100 degrees outside in Florida, windows everywhere that were leaky, 46 air conditioning units. And so that was a lot of just overhead, which number one, donors don't like to support in any way. And then, but number two, it was our mission to house and facilitate and co-locate nonprofits. And really, the extension of that was the ease of service for the people that came there, so that they could, for example, shop services in the same location and not have to go all over the place. In my struggle to define what it was that we actually did and why it was relevant, I joined a national network of other nonprofit centers. And I went to their conference, and it was in Colorado. And I met a researcher there named Danielle Varda, who was doing network science. And I, having an academic background, was like, bingo. This is the person and this is the thing that will legitimize our mission in a way that I can actually drill it a pretty heady concept down into the why in a way that was more of an elevator speech and not a novel, right? And so I met Danielle and got to know her and her work. And at the time, she was faculty at Denver. She had this kind of network science gig on the side, and she was really passionate about it. And we just kept in touch over the year of, I think she knew I was passionate about my campus. She was passionate about her work, and I just kept having this gut feeling that somewhere we could intersect. At which time the S4A opportunity came across her desk because she had already been a partner in your funding, and she sent it to me. This is it. That's how my introduction to Robert Wood and S4A began.
Fantastic. Very helpful to see how that and involved in alignment with the mission of your organization. In terms of the specific research project that you ended up developing and ultimately submitting that was funded through S4A, tell us a little bit more about how that idea for your project was generated and how it evolved over time, between you and your colleagues and Danielle as your research partner.
Yeah. So my internal colleagues, not coming from academics, were like, "You want to do what?" And I was like, it will legitimize us more. I promise. I promise. Like, this is the thing. This is one of the major pieces that we need to do. And I trust Danielle. I had seen a little bit of her network science on during a Zoom with her. And the other thing was, I knew that the campus's reach was larger than our geographic footprint, right? So I knew that we were networking beyond the walls of our campus, which I also felt like would ground our mission even more, or the importance of what we do. And I realized that she could measure that with how many other organizations were we outreaching to. She had a term called carrying capacity, and it was kind of like when folks get discharged from a traditional healthcare setting, where is the nonprofit community picking up in that space? If it's which social determinants of health is the nonprofit community really covering? And for the most part, we don't get reimbursed for that, right, from any sort of insurance company. So that's where the fundraising comes in. So Sarasota is fortunate to have quite a bit of philanthropy, not only in individual private donors, but also a number of community and private family foundations. And I knew that they needed to see this data and to legitimize what we were doing. And I knew, and this was almost the charitable part on my end, that if the other organizations were able to show their place in the network, it would help them as well. And Danielle's technology was able to do that. And a really cool, the second round of funding that we got from Robert Wood gave each participant organization a profile of their position in the network, how many relationships they had in the network, which ways did they go, was it bidirectional relationship, and sort of their power in it. And they were able to use that data for their grant applications and in their marketing and in their fundraising. So it was like win, 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 right, all the way around. And that was I will say the the questionnaires that they had to fill out were lengthy, but that was the carrot of why it was valuable of their time, was that they knew they were going to get this report on the back end that would really be able to be woven into their business practices.
That is really useful to hear. I mean, you're speaking about the how this research project was designed to be valuable to your community-based organization, your network of community-based organizations, and also how you were already thinking as a leader of that network, how you could strategically use data and results from this project to demonstrate the value and the effectiveness of what you're doing collectively, your model. So that's really
Right.
that's
And
really great to hear.
I did want to touch on the piece of like Danielle's perspective. So, she has the science. She needed the partners, right? She needed the
Right.
community people. She needed the variables, the data. Well, I was the major connection to the data. And so my strength and superpower in that study was my relationships here. And obviously hers was the chunking or crunching of the numbers and the data. And so that's where that partnership was really a great marriage in how projects like this get done.
Absolutely. And I do want to call out, you mentioned your research partner, Danielle Varda, as an academic researcher, but also her organization, Visible Network Labs, I think was the primary research collaborator with your project. So great to hear. I want to ask a little bit more about what that partnership looked like between your nonprofit organization, Glasser Schonbaum, and the research partner, Danielle and Digital Network Lab. How did that partnership work? How did it work as you developed your initial research proposal for Systems for Action?
Yes.
How did you make key decisions about, like the research questions you wanted to answer and how you divide responsibility or divide up the budget, those kind of things? How did that work?
Yeah, it was a lot of back and forth emails, regular meetings on the calendar, regular Zoom meetings. Um, she had some graduate students that were helping her too, and so they had some questions that they were kind of interested in. And you know, I wouldn't even use the word compromise because that sounds like maybe there was a point of conflict, and there never was. It was really interesting because she was coming from such an academic environment, and we were kind of just boots on the ground. And I think we both craved each other's knowledge and input, because I sort of missed being in academics, and she really wanted more community exposure and her team. And so it was always respectful, always very open. Um, it was a really great, it was a really great relationship. And there was never any hesitation on my end or my team's end to say, wait, what, or that doesn't make sense, or can we go back at this? And then the platform, the grant platform, of course, we both had access to it. So she would write in it and then shoot me a text and say, hey, check out this section, feel free to rewrite. I would write a section and text her. And it was obviously where our expertise was, are the sections that we really kind of I would take the lead on, but then she would, everything was just an open book. I was never insulted or anything if she changed some of my text, and same thing with her. And then it was actually quite touching because some of the things I would say, she would be like, oh my gosh, I never really thought about that. Like, I wouldn't know that. Same thing for me to her, like, oh, right. Okay. That makes sense. And so there was a lot of learning going on in that partnership. Sarasota is a town rich in resources and elderly retirees, and not in academics. And so she was in Colorado, and so it was a couple hours time difference. And if anything was a struggle, it was that, right? Like just getting meetings on the calendar and the time zones. But there was no local academic institution that we could have partnered with here. And I say that because I want your grantees going forward to think outside of their community, outside of their state, even. I mean, we were halfway across the country, right, with Daniel's partnership, and never missed a beat. It wasn't a big deal. Do I wish that we had like Florida born and bred partner? For sure, right? Just to keep it here. But I don't want your grantees to think, oh, I can't look in New York, or I can't look in Michigan, or whatever. Really cast a wide net, because that partner is so helpful. So my team did not have much of an academic background, and really kind of fell on my lead and kind of trusted my opinion. But I did have my chief operating officer was my finance guru. So when you asked about budget, she had a lot to do with the budget back and forth between Danielle's team and my team. I kind of gave her the lead on the budget, and she was the one responsible for getting the budget forms back to S4A when those were needed. So, and I double checked them, but it was important that I felt like the team also had ownership. So when some of the final reports came out and we were pulling community together, I let my marketing person do that, and say, how do you want to put these results on our Facebook? How do you want to put these results in our news blast, and let her customize that. So it was important to me that while I would say, the lead, that each integral member of my team felt like they had ownership of this and a piece of it.
That's really useful to hear, and great perspective, and excellent advice on multiple points about sometimes looking beyond your own neighborhood and community to find the right kind of partners. Very good advice. When it came to actually executing your research study after you submit the proposal and were funded, I'm wondering about the role of your community-based organization in the array of research activities that played out. Was your organization, as the community-based organization, involved in all aspects of the research study, or were there some activities where your research partner took primary responsibility, and other activities where the CBO led the charge? How did you kind of divide roles and responsibilities that way?
Right. Danielle's team would say, okay, we need the list. Like how many assessments or questionnaires or network partners are we gonna look at? So then that's my team. It's back in my court. Well, this nonprofit and that nonprofit and these guys. And then Danielle would say, okay, categorize them. Who are foundations? Who are in children's services? Actually, I think that idea was me, because I wanted to look at demographic served networks, like how integrated were they all working together? Because that's really important, because You've probably heard it, but in the nonprofit community, donors are like, oh, you're duplicating services. And I wanted to say, no, we're like strengthening each other. Even if 5 of these organizations who serve foster kids are full bore, they all have a waiting list, right? So, like, it's not duplication. It's like, that's how, that's the quantity and demand here that we need. Okay, so we did separate by demographics served. And then the foundations. That was interesting because that I knew it was going to be, I'm going to use the word political, but I knew it was going to be interesting because some of them have reputations for not playing well in the sandbox together. And we knew that, and the data showed it. And so when I brought the foundation leads in a group to see this and tell them, like, oh, this one says it has a relationship with you, but you don't say you have a relationship with them. There was crickets in the room, and I knew it was kind of a risk because I was a grantee, but I wanted them to see it, and I felt like it was important that their reputation, which nobody would really tell them about, was shown in data. It's black and white, like you can't argue with it. So that was an interesting piece of it. And these were things I had to tell Danielle and her team that I wanted to tease apart. So I drove the bus on that. She always just said, this is the step we need to take next for my system. And then here's a report of this. What else do you need? And then here's a report of that. And then at the end, we did multiple community meetings to show everybody and then show them how to access their own profile in that. And that was really fun. And we did do that by sector, by demographics served, so that it was kind of all in a peer group. And then I haven't mentioned this, but the hospital, our main hospital, which we only have one really big one, was a part of all this too. And it was really interesting to see their weight and influence in this. And of course, that's what we were looking at, like, how do people discharge from the hospital and go into nonprofit services? So they were at the core. I mean, Danielle's work looks like a spider web with nodes in it, and they were in the middle of the web, right? Which they should have been, and sort of then like poking out. And the foundations were really prominent in the web as well. So it was really cool. That's probably some of the work I'm most proud of in my nonprofit career.
It really does sound like a very productive and beneficial collaboration. Um, I wonder if there are any challenges that you encountered in working,
Yeah.
across that boundary between a community-based organization and a research partner. You mentioned, logistics and time zones being one issue,
Yeah.
but any other challenges that you confronted and how you dealt with them?
Yeah. I mean, the survey was long, so everybody's time is limited. And we did this, by the way, twice, once before COVID and once after COVID. So there were a few different challenges because of COVID on both sides of that. But I had to poke a few sleeping bears a few times to, like, complete your data, we needed your answers last week. How's it coming? What can I do to help? And people were like, Kameron, it's so long. I'm like, I know, just keep going. Can I bring you like a coffee? Like, what will it take? That was probably it. Like, just and we really were methodical. We really thought through, like, oh, well, it can't be Thanksgiving break. It can't be during spring break. It can't be over Christmas. We really tried to hit calendars where, the majority of people are working, and not high vacation times, because we knew, and I was honest about it on the front end. When I sent the email with the link, I'd said to my partners, get comfortable. It's kind of a haul. And by the way, you can take a break and come back and all the things. So that was the only real challenge, was like, a few of them missed the deadline. But of course, Danielle had really smart team members, and we knew that was probably the case. So we set a real early deadline and then let people sort of dawdle along as they could. But yeah, it was fascinating, really fascinating.
That's an excellent point, though. I know that is I think a challenge that is pretty common, is the time frames and competing deadlines that face a research community versus a community-based organization. contexts, they can be very different in terms of the timelines and the kinds of pressures and uh, competing activities
Yeah.
that people can face. So
Yeah,
it
I
sounds
would
like you
say
all will find a way to navigate that.
give your partners, your community-based partners a long runway to get
Right,
things done because it's not a world that they're used to operating in. And the other
right.
thing is here, in fairness, a lot of entities and funders are doing surveys to them all the time. So there's that fatigue too. And ours was particularly long. So just making sure that you're building in a timeline that's generous.
Very good advice. Very good advice. Um, Well, I mean, it's really helpful to hear about this partnership and the project, the ways that things played out there. I wondered, thinking about other similar kinds of community-based organizations that may be looking for a productive research partner like this. Is any other advice that you can offer about what to look for, what to ask, how to find a responsive and collaborative research partner like you found in Danielle Varda in the Visible Networks Lab?
Yeah, a couple ideas. So I always tell CBOs this, community-based organizations, nonprofits, um, know what results you're seeking first. Like, what are you trying to do? And get really clear about that. What are you trying to prove? What are you trying to say is your impact? And then seek funding. Don't
Mhm.
seek funding and then create your impact from the funding. It's not going to work because you're not selling. You have to sell your impact on a grant in a grant application. And if you're not really clear about it on the front end, it doesn't sell well. And I do see a lot of organizations like, well, I saved the puppies, they should care. That's not going to get it. So know who you are, know where you're trying to go, and look for funding to get there and be really articulate about it. If you don't have a research partner who's affiliated with academics or some sort of institute, they are easier to find at conferences that may be similar to your mission. Like I found Danielle, and I was at a housing conference recently in Florida, and there were a lot of research university partners there that are all over the state. And I kind of had that idea, like, well, they're great, and they often have students looking for projects, and all the things, or the faculty member needs it. So that's a good one. And of course, Googling like who's doing this in the country, how can who and your peer group. So my peer group at the Nonprofit Centers Network was really helpful in this, and just talking with it through an idea like this through them, saying, is anybody doing this? Like, does it sound reasonable? And Danielle had worked with some other network systems in Colorado where kind of similar approach, um, or similar, very diverse groups of people that still had a network that she was trying to measure, right? And that's kind of how we were. That would be my recommendation. And I mentioned earlier, Sarasota does not have heavy academic presence, but that didn't stop this. And I think there are many communities like Sarasota where there's a lot of activity going on and philanthropy going on, but the research isn't there because the culture is just not quite there. I mean, we're a little weird because we're so retirement age heavy. Um, but don't let that stop you. Really look for those partnerships. And you don't know what academic institutions are looking for you. And sort of, that's actually, I'm glad I'm on this track here in my brain, because when I did a couple of your kind of webinar things with folks from academia, they were like, well, how do I connect with CBOs? I thought,
Right, right.
we're humans just like you. Like, call us. Like, if you see our mission and you want to know what we're doing, oh my gosh, what an honor. Like that would be really awesome the other way. And so, I would think CBOs are very open to a random phone call from academics saying, hey, I looked at your website. We may have a synergy here. Can we talk about it? What a gift. What a gift.
Well, this is excellent advice. Thank you so much, Cameron, for letting us learn a little bit more from you. We've learned a lot through the research projects, multiple projects that you've conducted through the Systems for Action program. Congratulations on that successful work and your successful collaboration. We can't wait to see what you're going to be doing next
Me too.
in the world.
Yes.
But thank you for letting us learn from you and your colleagues and your great work. So
Thanks so
thank
much,
you.
Glenn. Take care.